So I just wanted to welcome everybody today to our Lunch and Learn, and I'm so thrilled that we have our pharmacy team with us today who's going to be sharing all kinds of helpful information. I'm Lexi Ladd. I work in the marketing department at Cambridge Health Alliance. Unfortunately, fortunately for Roberta, who usually runs these meetings, she's on vacation. Unfortunately for us, she won't be with us today. So I'm filling in for her to make sure that we have our Lunch and Learns continue. So I'm going to start presenting in a moment, but first I'm going to introduce Ebony Jackson and Tyler Kudiak. They are both pharmacists at CHA, and they have all kinds of incredible, valuable information to share with you today. I've had the pleasure and privilege of working with both of them on multiple projects, and I can't tell you how amazing they are. And I can't wait for everybody to learn more about the resources that we have at CHA and what's available for our patients and also the community. So I am going to begin sharing now. Here we go. All right. I'll just turn it over to you both and let you begin, and you can just cue me as we move forward.
Perfect.
Okay, thank you, Lexi, so much for the wonderful intro. Again, like she said, my name is Ebony Jackson. I'm in the specialty pharmacy here at the Cambridge Hospital, and I'll turn it over to Tyler for a second.
Hi, everyone. I'm Tyler Kudiak. I've been with CHA for a couple of years now, and you can find me in both the outpatient setting and also in the specialty pharmacy.
Yes. And we hope that while you enjoy your lunch today, you are indeed learning something about pharmacy services here at CHA. All right, so just a brief outline of what we'll be talking about today. So first, we just want to tell you why CHA. So if there's a pharmacy on every corner, why is CHA Pharmacy so different? Then we'll give you a brief overview of our services. We'll discuss the pharmacy staff and who you might be interacting with if you come to the pharmacy. We'll discuss the life of the prescription, the importance of access, and finally, locations and hours of our pharmacy services. Right, but before we get started, earlier this year, we had the pleasure of teaming up with marketing to create a video for purposes just like this. So we want to explain why pharmacy is indeed a part of your care team. So we'll play the video, and then we'll move forward with the presentation.
When you think of your doctor and your nurse, you should also think of your pharmacist. So here we're one big happy family, and all we want to do is make sure that the patient has the best healthcare experience possible. So that's one of the biggest things I think makes us stand out.
At CHA, we have terrific pharmacy integration into how we deliver healthcare, and I definitely see our pharmacists as part of the care team at CHA. I think a great thing about working with the CHA pharmacy is I just know my patients are going to get their medicines, and that's a real relief. It makes my life easier for sure, and I'm certain it makes my patients' lives easier as well.
I was diagnosed with stage 4 lung cancer in June 2021. Back during my chemo, I was supposed to have some medication filled out at my local pharmacy. My brother went to pick it up for me, and there was nothing. When he got home, I called CHA Pharmacy, and I spoke to a very, very nice pharmacist who actually had it delivered to me within a couple of hours, even though it was past 5 o'clock when I called. That was very, very helpful that day because I was in a lot of pain.
I first interacted with Vic at the specialty pharmacy. We ended up helping him. We were able to fill his prescription, deliver it to his house, and over time we were able to develop, a relationship. And that's the beauty of the career, interacting with our patients and getting to know them better and helping them the best way that we possibly can.
We want to provide care for all and access for all. Part of access means that we don't want money or distance or anything stopping you from getting your meds every month. One of the things that we started doing was providing free medication delivery to all patients. As long as you live in the state of Massachusetts, no matter where you are, we will find you and we will bring you your medication.
The free home delivery really makes it easy. My local pharmacy delivers, but they charge quite a bit of money, so that makes it very easy for me.
There's enough things to worry about paying for your medication should not be one of them. So our goal here at the CHA Pharmacy is that our patients get the best medication at the most affordable price. That's why I came here. That's why I continue to stay here. And it's a really good feeling to know that we are actually making a huge difference in our patients' lives.
Okay. So like I was saying, a lot of what Tyler and I will discuss today is basically an echo of what you heard in the video. So let's just go on to talk about why CHA. So our model here is care to the people, and that's something that we really take to heart. So I talked about access in the video, making sure that nothing is stopping you from getting the care that you should have. Another form of access is the access that we have to other members of the care team. And so what that means is because we are a pharmacy that's part of the healthcare system here at CHA, then we can send messages to the doctors, to the nurses, really anyone to kind of help move issues forward much faster than it would be able to happen if you were at an outside pharmacy. So again, we're part of the team at CHA. And then we have a true connection to our patients. So what does that mean? It means that over time, we start to form a relationship with patients. So when you come in for your medications every month, or when we talk to you, we start to we recognize your name or your voice, and you become kind of part of the extended family here at CHA. So it's very much so a family feel. And a lot of our front staff people that you'll be interacting with, but Tyler will explain later, they may speak, 2-3 different languages. But for those who don't, CHA has a robust interpreter system. So no matter what your native language is or what you feel more comfortable with, we have a way to make sure that the communication is accurate. And then lastly, again, we don't want money being something that's stopping you from getting your medication. So if you're ever concerned about, I can't afford that medication, never let that stop you. Call the pharmacy, come to the pharmacy, and see if you qualify for any assistance. All right. So just a brief overview of services. So when you think of the pharmacy, probably the most common service is the actual outpatient pharmacy. So we have 3 different pharmacies that we'll talk about later. And that's when we're filling your prescriptions. And if we're sending them to your home, they're coming out of one of our pharmacies. I also want to talk about our PACE program. So our PACE pharmacy is a part of an all-inclusive program. So PACE stands for a program of all-inclusive care for the elderly. And what that means is not only is your pharmacy a part of the team, but your primary care doctors, your specialists, anything that you would need, they're kind of all under one roof. They all work very, very closely together for the patients in this program. And so if you would consider yourself older or elderly, or maybe you have a family member who might be, then you should look into the PACE program to see if it's something that might work for you. We can give you the number again, but I'll just say it verbally. If you want to contact PACE, the number is 617-575-5850. Just call them and see if it's something that you think you might qualify for. Next, I'll talk about the centralized ambulatory medication services. So lots of words, but what we call it here is our central refill department. And so there's one department at CHA that handles all of the refills for most of the clinics. So if you're calling and you say, oh, I really need a refill, or you're pressing the button that says, if you need a refill, press this, it goes to this amazing call center where there's a group of pharmacy technicians who are then kind of pinning the medication and making sure everything's nice and neat to the doctor so that you can get your medication faster. So the turnaround time has been significantly faster for your refill since we've started this service many, many years ago. And then I think that's everything for that part. Tyler's going to take over and talk about the delivery services.
Yeah, so as Ebony mentioned in the video, and Fick as well, our delivery services have really become an integral part of what we are as a pharmacy. It's huge on access, and not everyone can always make it to the pharmacy to get their prescriptions. Some people live far away, or they just don't have the time. So what we started here is a free delivery service to anywhere in Massachusetts, free of charge, so you don't have to worry about that. And it's an actual person who's going to come deliver your medications. So you'll actually interact with them, and it's just a more personal touch that we do here at CHA. I'll get into more of how to sign up for that and get more information on a later slide, but we'll talk about that in a bit. So as we mentioned, you're going to deal with a lot of different people at the pharmacy. So we like to consider ourselves as pharmacists the most accessible healthcare professionals. So what that means is you can call up any pharmacy, you can go to any pharmacy, and you have a pharmacist right there that's going to answer all of your questions. It's kind of hard sometimes to talk to your doctor directly just because they have so many patients, but we're always there. When you call a pharmacy or you go to the pharmacy, but the first person you're probably going to meet is a technician. So technicians we consider, if you're comparing it to your medical team, like our nurse. So the first person you're going to deal with, they can help you with refills. They can help you answer some simple questions that you may have. They're the ones working on your prescriptions and actually putting in the work. And the pharmacist, we're going to compare it to your doctor. So as pharmacists, we have advanced degrees. We have the knowledge to answer your complex questions and help out your doctors as well. And then we're doing the final review of everything for you to make sure that the medication you're getting is good and safe for you and appropriate for what your doctor is prescribing. Now, you can always ask for a pharmacist. You don't have to always talk to a technician, especially if you have a complex question. We're always there, and there's always going to be someone there to help you. And then one of the biggest questions I know we get as pharmacists and at the pharmacy is, how exactly do I get my prescription in my hand? So it's not as simple as just the doctor gives it to you and then it's in your hand. There's a lot that goes on behind the scenes that we try to make as quick and easy as possible for you to make sure you have the right medication. So just to briefly go over it, the most common way these days is how doctors send the prescription is electronically, kind of like an email. So they'll send it to the pharmacy. We at the pharmacy get the prescription. Usually at that point, a technician takes over and they're going to enter it into our computer system. And then if you have insurance, we're going to send it over to your insurance. If you don't, then we go back to the financial assistance we talked about earlier, where we can give you a discounted price if you qualify, and we can always answer those questions for you. If you have insurance and the medication's covered, we're then going to fill the medication. This is actually putting the pills in the bottle or pouring the liquid out for you, making sure everything's correct. And then that goes to the pharmacist. At this point, it's where everything gets reviewed. So we're going to make sure that it doesn't interact with any of your other medications. We're going to make sure it's safe and appropriate for you and for what you need it for, and to make sure you don't have any other medications that do the same job that maybe we could talk to your doctor to simplify your medication regimen. At that point, once the pharmacist deems that it's safe to use and it's the correct medication, we'll send you that message that it's all set to pick up and you can come get the medication, or you'll get a notification to call the pharmacy and we can set you up for that delivery. Now, back to the insurance, if it doesn't cover it, a lot of the times you'll hear this word called prior authorization. And what that means is that your insurance just needs a little bit more information of why you need to be on it. So we'll talk to our central refills department that Evelyn talked about, and they'll help work with the insurance company and the doctor to make sure that this medication can get covered for you. Sometimes it doesn't always work, but in those cases, we always have that financial assistance where we can offer you that discounted price as well. So we have 3 convenient locations for actual pharmacies. Our first is located in the Cambridge Hospital, and we're open on the weekends from 9 to 3. The second is on the East Cambridge, at the East Cambridge Health Center on Gore Street, and they are open only Monday through Friday. And then also at our Malden Family Health Center, and they're open Monday through Friday, and then again on Saturday from 10 to 1. We also have our specialty pharmacy services, which is mainly going to be by telephone. But there's always going to be a pharmacist available. So we have a 24-hour, 7-day-a-week phone number that if you need anything, whether you're part of the specialty pharmacy or not, you can always give us a call, and we can always try to help you. So there are a few ways to sign up for one of our pharmacies, or if you have any further questions, or if it's even just one medication you want to know about, you can always call our main number at the 617-806-8566. And then that's option 3, and that will get you directly to a pharmacist or a technician that can help you. We also have an email at pharmacy@challiance.org. And then there's our CHA website, which has everything that we talked about here today. So you'll see here that if you want, you can watch the video of Ebony again. It has all of our locations and our services. And also you can refill prescriptions online. With that too, there's also a link if you go online to RX2Go app, which you can download on either Apple or Android, and you can pick your pharmacy right from there and do everything right from your phone.
And I would like to add that since technology is such a big part of our lives today, the pharmacy also has a lot of platforms that can help you, kind of refill your medication. So we have an automatic refill system to kind of help you keep up with your medications. We have a bi-directional texting system. So that means that not only can the pharmacy send you text messages, you can send the pharmacy text messages. So some people just don't like to use the phone. They just aren't big phone users. So then you can kind of text back and forth, and the communication is just as good. And we also have an app called RX2Go. So you download the app, you find the Cambridge Hospital, you put in your information, and you can just easily request your refill from the app. So again, if you're not a phone person or a text person, maybe you're an app person, we truly try to have something for everyone.
Great. This was great. Thank you both so much for all of that information. It's really, really helpful to give us an overview. And welcome, Heritage. I didn't have a chance to say hello to everybody. Hi. I'm so glad that you're here with us. So now, and I apologize for my voice, but I think now is our opportunity for people to ask questions. And I don't know whether or not anybody at Heritage or Herman, if anybody has any questions that you would like us to answer, you can put them in the chat, and we're happy to get those answered for you. While we're waiting, if people do want to add things, I do have a few questions myself. I was just sort of curious how you both decided to become pharmacists, and what's your history?
I can go first. So I always knew I wanted to go into healthcare, but I didn't know which fit would be right. And like I said, when I was speaking, the pharmacist I feel like is the most accessible healthcare professional. They're always going to be the first person you go to, and that really resonated with me. So I love dealing with people. I enjoy the pace of the work, and it was a really good fit for what I want to do. And to be honest, 6 years of school sounded a lot better than going to med school and doing the whole residency and all that. So it worked out well for me.
Perfect. Ebony?
Yeah, so very similar story. My mom's a nurse, have a sister who's a doctor. Neither one of those paths seemed to really fit me. So I started to explore, like, there are other options in healthcare where I could like truly make a difference and interact with patients, have like some advanced knowledge. And I landed on pharmacy. So it's amazing what pharmacists, like how the role has changed over the years. And I'm excited to see how it will, continue to change. So it's exciting.
Definitely. I feel like one of the changes is pharmacists are much more accessible, I think, than they used to be. But are there other things that have changed sort of, in the past 20 years or so that that have really made a difference in how we connect with our pharmacists or just within the industry?
Yeah, I'd say, many, many years ago, pharmacists were just known as the drugstore guys who were what they call pushing pills, just counting tablets all day. And that's kind of the view that a lot of people have of pharmacists. So it's just, in the past 20, 30 years and probably before, but that's when pharmacists have really begun to be known as a part of the care team, So pharmacists now have a doctorate level education. And so I think the industry and healthcare in general is starting to see that we can offer much more than even what we're doing now. So as time goes on, I think the role of the pharmacist will continue to expand to bigger and broader things. So some pharmacists in different states and with different protocols are able to actually prescribe meds. So, for someone just thinking about it, like your pharmacist prescribing a medication that may not seem like something that, is the norm. But I think down the road, you'll see more and more of this.
Definitely. And I'm wondering also, I think one of the things that makes CHA unique is we're so innovative. And I think we were one of the first to actually embed pharmacists into our primary care practices. And I think that's incredibly unique. Is there anything that can you sort of expand on that part of what a pharmacist does at CHA?
Yeah. So I'm sorry, Tyler, I don't know if you want to go.
You know?
So the outpatient pharmacy services is only a piece of what we call the pharmacy enterprise, right? So there's the outpatient pharmacy, which is Tyler and I. There's the inpatient pharmacy, so the people who are kind of approving meds and make sure that while you're in the hospital that everything is safe. And then there are our pharmacotherapists. And what that is, so they are pharmacists who are highly skilled in certain areas like diabetes and blood pressure, and they work in the clinics with the doctors. So they are very focused on certain areas. So the doctor may come say, well, Tyler's blood pressure is like sky high. I'm not quite sure how to get it down. So they'll send a referral to the pharmacotherapist in the clinic, a pharmacist, and then they'll manage the person's blood pressure. So again, when I say we're a part of the care team, whether it's inpatient, outpatient, or in the pharmacotherapy realm, we truly are a part of the care team. And so I like to joke and say that, like, no matter where you look at CHA, like there's a little smidge of pharmacy. We're involved in so many little things. And our hope is that, we're improving patient care and access in the process.
Is that integrated model the same at CHA PACE?
At PACE, yes. So there's also pharmacotherapists that work with the PACE program. So if you're on any blood thinners that require monitoring, they're handling all of that. So again, PACE is just again an all-inclusive. So think about going to a resort where you've got your food and your drinks and access to the beach. PACE is that version of healthcare for the elderly. So it's all nice and neat in a nice little package. And I can give the number again to PACE for anyone who has questions. So that number is 617-575-5850. So I encourage you, if PACE sounds like something that you like to experience, I highly encourage you to call that number and see if you can become a member.
Ebony, I think I'm going to steal that analogy from you because I really appreciate it. And I wanted to give a shout out for pharmacy that works so closely with inpatient care, because some of the pharmacists have been integral in helping to move along some of the referrals from the primary care physicians. So I've been impressed on how closely everyone works together.
And Alyssa, do you want to just introduce yourself so that people know who you are?
I might have seen some of those people from Heritage before. Hello, how are you? Because Roberta had taken a hiatus. I had visited, so it's hard to see, but nice to see you all. Yeah, so I'm working with PACE. I've been here for almost 3 years. I used to do outreach in the community. Now I work more closely with the providers in CHA. But PACE, as Ebony says, is like going to a resort. Um, and instead of having a chef, you have a nutritionist, and instead of having the captain, maybe or a cruise, instead of having the captain of the ship, you have your doctor, and the co-pilot would be the nurse practitioner. And we have social workers, physical therapists, occupational therapists, vans that can pick you up and take you to appointments. We do have a number of people at Heritage who are on the program. Maria Frazier is very well versed on the program as well. We're always happy to speak to anyone, find out if you're eligible. It is for low income adults 55 and older. If you're on Mass Health, you would generally qualify financially. A nurse would need to come and evaluate you and ask you some questions to see that you qualified clinically. Enrollment is only on the first of the month. We have an application we help you send in to Mass Health to get approval. They take about 2 weeks. And once again, we certainly, the number that Ebony shared, like I said, Maria has information as well. Happy to answer any questions. Thank you for that opportunity. Haven't done that in a while.
Thanks for being with us, Alyssa. That was wonderful. So, Tyler, I have a quick question for you.
Of course.
One of the things that I've been involved with is helping people connect with getting COVID vaccines. And as we know from the last year and a half or whenever the vaccines became available, it's been sort of a constant changing. I feel like we've been running after the train, and I just I'm wondering if you could speak a little bit to the role pharmacy has played in helping people address COVID, because I think there's so much that pharmacy has done and been involved with that people don't know about.
Yeah, so I've been involved actually right since the beginning. That first day when CHA got vaccines, I was there on the front lines. We've done a ton as a health system. We opened up an immunization center that was located in Somerville. We had just recently closed it. Now that things are hopefully slowing down, but we have them in all the outpatient pharmacies, Moderna and Pfizer. We're also still running a mobile vaccine clinic that's located in Everett, Everett, Revere, and Malden, 3 days a week. So we're still there to protect everyone. And now with all the boosters coming out for children as well, we have pediatric vaccines. We do 3 and up at the pharmacies. And then most of the primary care centers that are working with children also have the vaccine as well. But again, that's all connected through pharmacy. So we are the first stop for anyone who might have a question about it. And we really are here to protect you with all of your immunizations, not just COVID vaccines, but we'll do flu shots. We'll get you your vaccines to help you to get caught up on any health maintenance. And if there's something we can't provide, then again, we work directly with your healthcare team and we can get that through your primary care.
Excellent. Thank you so much. Well, we have actually reached the time. Is there anything else that you two would like to add, Ebony or Tyler, before we wrap up?
No, it's great for the opportunity. And please reach out with questions.
Yeah, of course. Yeah.
Great. Thank you so much for being with us. This was wonderful. We do our Lunch and Learns every first Wednesday of the month. And you can find out more about what our next one is online at Cambridge Health Alliance for older adults. There's a section that we are promoting the different things that we're doing for outreach to the older adult population. You can also see videos of our previous Lunch and Learns on that website. So I invite people to go check things out there. We've got lots of interesting things coming up with vascular surgery, and I think maybe more with podiatry and other issues. So we hope that you'll join us for future events. And thank you so much for being here. Cambridge Health Alliance is here for you in the community. We bring care to the people, and we're very grateful for you joining us here today. So we will see you in a month. Thank you. Thank you.
Thank
Thank you, everyone.